The Dallas-Fort Worth Business Group on Health, a North Texas coalition bringing together the best and brightest minds on benefits and healthcare, presents a powerful new documentary series entitled The Essentials. Each episode presents one compelling story about how a key DFWBGH member organization embraces transformational strategies on benefits and healthcare that are designed to sustain employee engagement and dramatically reduce the cost of care. Episode 1 features DFWBGH board member George Moness and how human resources under his leadership has impacted health and wellness for employees of the City of Mesquite and the school district. Taking charge to make a difference in health and wellness, the members of the Dallas-Fort Worth Business Group on Health.
Mesquite is a small town. We're 140,000, but it feels like a small town in the big metroplex. I've been here since 1998. I watched the city grow in terms of retail, in terms of entertainment, in terms of sporting activities, and it's just a great place to live. First few years I was here, we saw continued rising cost in healthcare, and it was a challenge directed from city management and from our city council. What can we do to stem the rising cost of healthcare? It's not just rising cost of healthcare, but it's the rising incidence of disease. What can we do about what hospitals and physicians charge very little? What can we do about people's health? I think we can do a lot. I think there are several philosophies that made the clinic successful. Number one is a focus on prevention.
The greatest thing that I hear about the clinic from patients is that they can afford health care. If you have somebody who's living paycheck to paycheck and they know they're sick, finding money for medication or to see a doctor, it just doesn't happen. It's not at the top of their list.
Most of the employees of the school in the city have families. We do family medicine here, so we're able to pull them and their families in, render good care. We have patients who now come in and that if they have high blood pressure, that we need follow-ups, we need to do routine things, and how to better manage their disease process.
It is a remarkable situation. In and out in 15 or 20 minutes, with a pharmacy on site, is an enormous positive influence on my ability to do a good job in this community.
It took the faith of our city management council that we could impact healthcare costs, and the result would be healthier employees. And I think we've proven that, and we've saved some big bucks for not only employees, but the city, and therefore citizens in the form of taxes that would have otherwise gone for health care.
It's really important to reach out to people about the role that they're going to take care of themselves as far as weight management, which is a huge issue in the United States, and it's also a huge issue here in our city of Mesquite.
We're a predominantly male employer. With police and fire and public works, predominantly males. And men just frankly do not access health care like they should. They pretty much have to be forced to go to a physician.
The state of health care in the United States is in desperate need of individuals taking responsibility for their own health care, and that's what brings me here. My role with Cigna and with the City of Mesquite is educating people to try to take that responsibility and making them aware of the resources that are available to them.
I can go to that clinic at 7 o'clock in the morning, and by 7:15 or 7:20 on a work day, be called in to see the doctor. I know Hayward, I know the other professionals in that facility, and he diagnoses me very quickly. I walk out of Hayward's office, through the reception area, sit down, and in 7 to 10 minutes I'm called to pick up my prescriptions. That is convenience.
This clinic is a new beginning in where healthcare needs to go. I've seen the cost and the fragility of the healthcare system, and this is going back to the old school, the base ground of taking care of the patient first, doing a lot of preventative care, taking care of their families. We're not just a provider-patient, we're also friends.
We realized how important prevention was for all the employees that work outside. We provide sunscreen for employees. We have even provided broad rim hats. Guys like to wear baseball caps, but they are not as good as broad-rimmed complete hats for the protection from the sun. Prevention has been one of the big payoffs. We gauge employee satisfaction through satisfaction surveys. The clinic rates so high, it's in the high 90s, and the satisfaction with the pharmacy, the clinic, and not just employees, but employees' families, their spouses. That satisfaction cannot be beat by any other benefit that we have.
Members of DFWBGH are making sustainable progress in the area of employer-driven quality healthcare and impacting their company's bottom line. Interaction, learning, winning. The Dallas-Fort Worth Business Group on Health.